So today for the barium enema procedure, we're to be using the barium bag here, which will be containing the barium, and we have the tubing here. Connected to the tubing, we have at the end is the tip. The tip is inserted no more than 4 inches to the rectum of the patient. And when using the tip, we always apply lubricant on the tip. Also, we have the bulbs. We have this bulb, which is for the negative contrast, which is air. We have this, which inflates the balloon that is inserted into the rectum, which holds the tubing into place. This is another clamp that we use for the tubing. Also, we have a glove for the radiologist that is made of lead. We have gloves here for the tech, towels if anything needs to be cleaned up, or for the patient. These are the supplies that we'll be using today for the barium procedure. How you guys doing? My name is Joe. I'm going to be going through a BE procedure with you guys today. I previously showed you what materials I'm going to be using, so now I'm going to get the patient and I'm going to do that portion. Mr. Jerry Smith?
Yes, that's me.
How you doing, Jerry? My name is Joe. Can you give me your full name, date of birth?
It's Jerry Smith. I'm in University 12/12/97.
Perfect. And Jerry, why are you here today?
So I have like some pain in my stomach when I poop and everything, like there's blood.
Oh,
Yeah.
okay. And then before we start the procedure, can you did they have you already sign a consent
Yes.
for it? Perfect. And then is there any chance of pregnancy?
No.
No chance of pregnancy. Also, no chance of pregnancy. I have your consent. Okay. No allergies?
No.
No allergies. And also, I think it's kind of a battery of things that we have to ask you. The doctor already have you take any laxatives or anything to clear you out
Yes.
for the procedure? Perfect. Did they explain what the B is exactly? Or do you have questions about that?
Someone explained it to me, but it wasn't too clear on me.
So basically, what the B it's going to help detect any abnormalities in your abdomen. We're going to inject something through your rectum, and it's going to help coat the stomach, your intestines, and it helps just visualize any abnormalities. Hopefully, we could figure that out today. All right. Any questions besides that?
No.
Alrighty. So what I'm gonna have you do is I'm gonna have you take everything off, and then I'm gonna have you put this gown on. If you have any jewelry, any metal, I'll have you remove that also.
Okay.
Okay.
Thank you. Thank you.
So while my patient's getting ready, I'm gonna set up my room. My first image is gonna be the AP scout, where the patient's gonna be laying supine. I'm gonna detent my which I have it detented now. I'm gonna need a 14 by 17 imaging plate, which I have here. The SID is 40 for this image, so I have it detented at 40 SID. I have it at 40 SID, excuse me, and then I have it detented to the table booking. I'm gonna maybe about 85 to 25 is what I'm gonna use for my technique. And now I'm gonna go ahead and get my patient. Jerry?
Yes.
Hey Jerry. So what I'm gonna have you do, Jerry, is I'm gonna have you lay flat here. You're gonna be laying just face up.
Okay.
Let me get you a little stool. Go ahead. Yeah, so just lay flat. Watch out for this here. Just watch your head. So let me just kind of guide you so you don't. So watch your head. Go ahead and be comfortable. I'm gonna wang this back out. I'm good. my central ray is going to be horizontal to the center, to the iliac crest, right about the belly button area. Just double checking that I place my marker, which, excuse me, I have it right here. And then if I can just kind of get you to put your arms to the side, Jerry.
Okay.
And I'm going to be giving you some breathing instructions.
Okay.
So kind of just lay flat, relax, don't move. Jerry, let me place this lead over you, and this is for protection.
Okay.
But Jerry, can I have you taking a deep breath? Exhale. X-ray. Beep. Okay. And just relax. I'm gonna grab my plate. I'm gonna take a look at my image, and I'll be right back. All right, Mr. Smith. So I took that first image. All the anatomy's there. Now and this portion, this is what I'm gonna have you kind of on this, and it's called a Sims position, which you're just gonna like sideline position. And what's gonna happen is we're gonna insert the tubing and inside your rectum. It might be a little uncomfortable, but it's gonna, it's part of the procedure, and it's gonna let us see things a lot better. So what I'll have you do now is I'm gonna have you lie on your left side. So just kind of carefully watch your head. Yeah, just like that, perfect. So just try to be as comfortable as possible. I'm gonna get some gloves here. So now here that what we're doing, there's barium here in the bag shown. I have my tubing here, which is placed at least 24 inches above at the level of the anus rectum. I'm gonna be putting the tubing or the tip. Excuse me. I have a lube here, and when I'm placing this, it's not supposed to go further than 4 inches. Patient is in the Sims position, as I said before. I have a towel, and no more than 4 inches, and like I said, there's like a prominent bump that lets you know not to go past that point. So, Mr. Smith, what I'm gonna have you do is try to relax, and I'm gonna have you exhale when we're ready to place the tubing. So what I'll have you do, go ahead and exhale, sir. Okay, and when smoothly, nice and easy. Okay, now we have it placed in that position. And when I was placing the tubing, I made sure that I was placing it anteriorly and superiorly, and I was following the rectum, which is what I was doing while I was placing the tip. So now what's going to happen, depending on the facility, it's either the tech or the radiologist that will insert the air and the fluid, the liquid, the contrast. And here at our facility, it'll be the radiologist, and I'm going to be grabbing the radiologist to do that portion. Okay, so I just finished my first image, which was the scalp of my KB supine. Now what I'm gonna have to do, I'm gonna have the patient lie in a Sims position. Okay, Mr. Smith, can I have you lay on your side, and your right leg is gonna go over your left leg.
Okay.
Just watch your head, trying to go nice and easy. I'm just gonna move this.
Okay.
All right, I'm just gonna place a towel over you really quick.
Okay.
And so what's gonna happen now is this is the portion where I'm gonna put place the tubing inside the rectum. It's gonna be a little uncomfortable, but I'm just, putting something over you for modesty and try to relax as much as you can.
Okay.
So I'm putting on my gloves, and what I'm doing now is I'm gonna get my barium ready and the tip ready. So I have the bag placed here, and it's going to be placed at least 24 inches, and it shouldn't exceed the level of the anus. Also, I already have my patient in the Sims position. I'm gonna place the tip, and I'm putting lube on the tip. It's when it's inserted, it doesn't go over 4 inches. There's a little prominent bump that lets me know that I shouldn't go over that portion, which I'll be doing. And when I'm gonna place when I'm replacing it, also I'm always making sure that I'm gonna direct it anteriorly and then superiorly, following the curve of the rectum. Is the way I'm gonna be putting this. Okay, sir. So what I'm gonna have you do, we're gonna be placing the tubing inside. Go ahead and exhale, and then I'm gonna place that inside. Okay. Okay. So very. Are you feel okay?
Yeah,
So
I feel okay.
the tubing is placed inside and secured. So now what will happen? I'm gonna get the radiologist per facility. It can be the radiologist that'll put in the contrast, which would be the air and barium. So per our facility, it'll be the radiologist, but it can be the X-ray tech. So now that the doctor did his portion of the procedure, I'm gonna do several overheads. So for on the next overhead, I'm gonna have the patient in our right decubitus position for the image. Okay, Mr. Smith. So what's gonna happen now is we're gonna take a couple more pictures. For this one, I'm gonna have you lay on your right side, not quite yet, but you'll be laying on your right side. I still have you covered. Always make sure that you hold the tubing. So while I have the tubing held, can you lay on your right side for me, please? Nice and carefully. Watch your head, please. Okay, perfect. So just like that. You okay?
Yeah.
And just put your arms to the side just like that. Cover the patient up. I have lead here. Always covering the patient. Now what I'm going to do is put a 14 by 17 imaging plate and on his back portion. I have a grid here. Excuse me. And it could be a tight squeeze sometimes. So. Yeah, just watch out, Mr. Smith. It's kind of delicate, so
Okay.
I just don't want you getting bumping it, hurting yourself. So it is in the back. There we go. So this is a right lateral decubitus position for the image. I want my technique to be about 120 kV to 25 mass. The central ray is going to be horizontal at the iliac crest, and my breathing instructions will be suspend breathing at the time. So I'm going to be placing a left marker, and that's due to his left side being up, and I'm going to place some arrows to indicate that his left side was up, and I will place that on my grid. And I'm looking at for a 40-inch SID. Okay, just put your arms to the side. Sorry about that, buddy. Go ahead. Don't breathe, please. X-ray. Okay, and you could relax now. I'm going to be grabbing the imaging plate and be taking a look at that to see if it was acceptable. So now that I finished that other image, I'm gonna go ahead and put, for the next overhead, I'm gonna have the patient in RAO position. So Mr. Smith, what I'm gonna have you do is I'm gonna have you, you're pretty much in a good position, but I'm gonna have you place your right leg over the other one, just like that, and I'm making sure that it's like that. And I'm gonna, sorry about that, buddy. So I'm gonna put the, and I'm using a 14x17 plate. I'm gonna put my marker, place my right marker here. Excuse me. Make sure you detent it. Back to so I'm detented, 40-inch SID. Patient is covered with the lead. Also, always the essential rate to will be about 1.5 to 2 inches to the elevated side, which I have now. Also, I'm gonna give you some breathing instructions, sir.
Yes.
Don't breathe, please. X-ray. Okay. So now, if I take my image, I'm gonna take a look at them, make sure they're acceptable. Okay. So I took the other image. Now I'm gonna be taking another one, which will be my. I'll place the patient in a PA. And for this image, I'm gonna have 120 kV to about 25 mass. Also 14x17 imaging plate. My central ray is gonna be placed at the iliac crest. So what I'm gonna have you do now, Mr. Smith, can I have you lay flat on your belly? And I'm making sure that the tubing doesn't get pulled out. Always very careful of that. Let me cover you up, buddy. There you go. So I have the lead. Marker placement. 40-inch SID, as I said before. Central ray at between the iliac crest, MSP. I'm good. I'm gonna give you some breathing instructions, my friend. Don't breathe, please. X-ray. I have my image. I'm gonna take a look at it to see if it's acceptable. So the image was acceptable. Now I have my patient in a prone position. For this one, I'm gonna be doing the PA axial. So I have my 14x17 plate. I will be placing that in there now. For this image, the tube's gonna be angled about 30 to 40 degrees caught at the edges, which I'll be doing now. Okay, and always making sure that the patient is covered with the lead. I'm just double checking. Marker placement. There we go. Okay. Don't move, sir. I'm gonna have you taking a deep, do not breathe. Do not breathe. X-ray. All right, perfect. So I did take my image. I'm gonna take a look at it and I will be right back. So now I took the other position. Now I'm gonna have my patient in the LAO position, and I have him pretty much positioned. I have my 14 by 17 plate, which I will put in now. Go ahead and place my marker. Always making sure that the patient's still covered, the tubing's still intact. I still want to have about 120 to 25 kV technique. Also, my patient, he's in the LAO, so he's rotated 35 to 45 degrees. I want to make sure that my central ray is in the correct spot, which is 1 to 2 inches above the elevated side of the iliac crest. Excuse me. So stay just like that. I'm going to give you some breathing instructions, sir.
Okay.
Don't breathe, please. X-ray. Go ahead and breathe.
Okay.
And I'll be taking a look at the image, and I'll be right back. So I've taken my other image. Now I'm going to be doing my left lateral DQ, which I have in position. The grid and the plate are in there, 14 by 17. The top is near the armpit area, which is a good landmark. Also, I'm making sure that the technique is 120 kV, 25 mass. Always, and also my central ray is going to be horizontal at the iliac crest. And I'll be putting my marker in just a moment. Like I said, horizontal at the iliac crest. Let me move the patient. I'm going to be placing my marker. It'll be my right marker since his right side's up. I'll put the right side, and then there'll be arrows to indicate that that is the side up. Okay, 40-inch SID. Make sure that my patient's covered with the lead. Now, sir, don't breathe, please.
Okay.
X-ray. Okay. And I'm gonna go right over you. And I'm gonna be taking a look at this image to make sure that it's acceptable. So I just finished my lateral decubus. Now I'm gonna be doing my lateral rectum, which is same position, lateral position. The technique's gonna be 120 kV, so about 60 mass. The difference here is I'm gonna be using a 10 by 12, and then I'm always making sure, always double checking my my lead. So I have my 10 by 12 here. Make sure you got your marker placement also. So, one look at this. Also, I'm making sure that the central ray, is like mid-coronal level of the axis, which you're gonna palpate. Okay. And yeah, I'm happy to say just like that, sir. Don't breathe, please. X-ray. Go ahead and breathe. Now I'm going to be checking my imaging plate. So the last overheads were acceptable, all the anatomy was present. So what I'm going to be doing now is removing the tubing tip. So you're going to want to go ahead and lower the bag here. You always want to make sure that you have towels present, because it is common for there to be leakage. So So I have my towels present. Okay, Mr. Smith, what's gonna happen now is I'm gonna remove the tubing and tip. It's normal when I do remove the tip that you feel like there's leakage or that you really want to use a restroom. So what'll happen is I'm gonna remove that. I'm gonna have some towels present just in case there is leakage. I'll help you down. When I get you up, also you might feel a little dizzy. If you do, just let me know. So that's kind of the order of what's gonna happen. Okay.
Okay.
So what's gonna happen now is I'm gonna go ahead and exhale. Nice and easy. Okay. You did very well, sir.
Thank you.
So I'm gonna place some towels here. There's your towels, and I'm gonna help you get up. If you could want to just get up. Stay here just for a second or two.
Okay.
Do you feel okay? You don't feel dizzy?
Yeah, I feel fine.
You feel fine? Okay. Like I said, go ahead and try to use a restroom, or if you have to use a restroom. And when you go, it's normal for it to be maybe white or gray looking.
Okay.
So go ahead and take a step down, be careful.
Okay.
So I just finished the rest of my images and they came out acceptable. The patient is in the restroom. What you want to do when the patient is in the restroom, make sure that you get everything cleaned up. If there's any leakage, anything just needs to be cleaned up, go ahead and do that, which I already did. I'm going to be taking my last image now, which will be my supine KUV, and I'll have my patient come and take that last image. Mr. Smith?
Yes.
All right, we're going to take another image. So what I'll have you do is I'm going to have you lay flat on your back and just your head at that pillow.
Okay.
Just watch when you get up there. And for my image, I'm going to have my technique about 120 to 20 mass. I'm using a 14 by 17 imaging plate, which I'll be getting now. You want a 40-inch SID. You want to make sure that the patient is covered with lead. All the images. CR central ray, excuse me, is going to be about the level of the iliac crest. And we'll be taking our picture. I'm going to be giving you some breathing instructions. So go ahead and take a deep breath. Breathe out. Now don't breathe. Don't breathe. X-ray. Go ahead and breathe now, sir. And I'll be taking a look at this last image here. So that's the last image that I took. That's my final image. Mr. Smith, so we're all through now. I'm gonna have you get up. Okay. Go ahead and, so what's gonna happen, I'm gonna want you to drink a little more water, have a more fibrous diet, and it is normal to have a gray to white looking stool. That is normal. But if you're constipated or you just feel really abnormal, go ahead and call your doctor at any time. It does take 2 to 3 days to get your results back, but if you have any questions or any concerns at all and you feel like you need to go to the doctor, I want you to go to the doctor.
Okay.
Okay, but like I said, more roughage, more fibrous intake, more water, and it is normal for you to have a white to gray looking stool.
Okay.
Chalky stool. Do you have any questions?
No, I think that'll be all.
Okay. So you did very well. I know it wasn't the best thing in the world, but no, I'm hoping that you could, we were able to see everything that you want to see.
Yes. Thank you.
Good luck to you, sir. After taking our images, we will now evaluate our images. The first image that I will evaluate is my Scout, which is a KUB. And in my KUB, the ascending colon is visualized, also the right colic flexure, transverse colon, left colic flexure, descending colon. Not the entire large intestine is visualized, but this allows us to see some of the important anatomy. Now we will take a look at the PA large intestine. So in our PA large intestine, we're basically looking at the entire colon, which includes the flexures and the rectum. You want to make sure that the vertebral column is centered so that the ascending and descending portions of the colon are included. And in my image, you can see the ascending colon, the right colic flexure, the transverse colon, the left colic flexure, descending colon, and the sigmoid colon, and the rectum is in this area. So this is the PA axial projection of the large intestine. With the PA axial projection of the large intestine, the rectosigmoid area is the area of interest. So when taking a look at this, you just want to make sure that the rectosigmoid area has less superimposition than in the PA projection, and that's due to the angulation of the central ray, which is the axial projection, and also that the transverse colon and both flexures are not always seen in this image. So this is the image of the left lateral rectum. In the left lateral rectum image, you want to make sure that the rectosigmoid area is in the center of the image. Also, there's no rotation of the patient. There's the superimposed hips and femora. Also, the superior portion of the colon is not included when the rectosigmoid region is in the area of interest. Now here we have our large intestine, the PA oblique projection, RAO position. So in this image here, we want to make sure that the right colic flexure is less superimposed or open compared with the PA projection. So you can see that the right colic flexure has no superimposition, it's more towards the left colic flexure. Also, you want to make sure that the ascending colon, the cecum, and sigmoid colon are visualized. Now here in the next image here we have is the PA oblique projection in the LAO position, and in this image we're looking at the entire colon. So the left colic flexure has less superimposed, which is opposite from the previous image. Also, you want to see the descending colon, which is the area of interest. So for my next image, here I have my PA large intestine with my left lateral decubed position. And in this image, we want to make sure that the area from the left colic flexure to the rectum is seen. Also that there's no rotation of the patient, and that's evidenced by the ribs and the pelvis. And also the air inflated portion of the colon is the primary importance, and it should not be over-penetrated. So now in this image here we have demonstrated is the AP large intestine, the right lateral decubitous position. And for this image, we want to make sure that the area from the left colic flexure to the rectum is seen. Also, that there's no rotation of the patient, as evidenced by the ribs and pelvis. You want to make sure that the air inflated portion of the colon is of primary importance and should not be over-penetrated. The left side is up, and there is more contrast on the right side, the bottom side of the image. So the last image that was taken was a post-evacuation PA large intestine. So on this image, you always want to make sure that the patient has defecated or they attempted to defecate. And the reason for this is to eliminate as much barium as possible. If the patient cannot defecate, they can give up something to promote defecation. But this is the last image that was taken, which is the post-evacuation PA large intestine.